Welcome to the Digital Dose. I'm Zelcha Emanuel. This is a show where we cut out the noise and talk about what it actually takes to make healthcare technology work at scale. Every episode, I sit down with leaders, builders, and the disruptors who are changing the game. This is not theory. This is the real work. Today, we're getting into the question that I think every healthcare organization needs to be asking right now. How do you actually know if AI tool is safe, effective, and built for your community, not just for the company selling it? My guest today has spent his career at that exact question. He holds one of the world's first PhDs in machine ethics from UC Berkeley. He built a platform called Hortus Trellis that is essentially consumer reports for AI tools, matching over 2,000 AI products against 750 real-world use cases, including healthcare. And his mission is to make AI accountable to the people it affects, not just the companies building it. Tom Gilbert, welcome to the Digital Dose.
Thanks for having me. Pleasure to be here.
Absolutely. Well, Tom, you designed one of the first interdisciplinary PhDs, machine ethics at UC Berkeley. Most people hear that and ask, machine ethics, what is that? And why did you choose to build an academic career around it before it was cool?
Yeah, it's a great question, and it was quite the journey for me. The stakes for me were really personal. So I had a very interdisciplinary background even before I went into AI. I had studied a mix of fields, including philosophy and sociology and political theory. The questions for me were always about these classic humanities topics. What does it mean to be human? What is the good? How do we live well today at a time when technology was already changing incredibly quickly? Institutions were changing, politics was changing. And then when I was in grad school on the West Coast in the Bay Area in the mid 2010s, and I saw the latest AI tools and what they were able to do. This was back when they were still somewhat in the sandbox of beating some of the world's best chess players and Go players, board games like that. But I saw what those algorithms could do and realized it was generalizable. It was only a matter of time until these things could be applied pretty much anywhere, including in very high stakes domains like healthcare. And so the
Wow.
stakes seemed to be very high. And then also for me, the stakes were suddenly also very personal. So I grew up in a part of the country, Appalachian, Ohio specifically, that has always been very poor, very hard scrabble, and has always not been well served by the systems of care that surround it. Healthcare in Appalachia has never really been something to write home about for the people who live there. And what that has done to the culture there has made it so, there are hospitals, there are clinics, there are dentist offices, but they often don't serve people as intended, which means there's this kind of learned cynicism or learned helplessness from folks where they actually will choose not to go for an annual physical. They'll choose not to have a root canal. They'll choose not to go on a diet or modify their nutrition because to expose themselves means that they actually feel more vulnerable in the hands of a healthcare expert or provider than they would if they kind of just keep on their own. And
Mm.
when AI happened, even at that theoretical level I just was describing, I realized intuitively what AI will do is make that dynamic, that culture global. It will make everyone around the world feel like they're being represented and classified faster than they're being understood or recognized or helped. There will be less empathy. It'll be easier and cheaper to deploy automated tools to manage healthcare rather than to actually serve and make healthier the people that those systems apply to. And so that became very urgent for me. It was so urgent and so personal that I actually left the PhD program I was in to design this interdisciplinary program, which then was really just applying all these humanities questions that I named earlier. What is the good? What does it mean to be human? What is politics today? How can we do it better? But really ground that in what this new technology would make possible.
Wow. Well, you've spent years in research at Berkeley and Cornell, looking at how AI research organizational decision making. At what point did you shift from researching the problem to trying to build the solution?
It's a great question. It was a gradual process for me. When I was in the PhD program, I spent about 5 years at an AI safety lab. It was one of the leading academic safety labs on the West Coast. AI safety is the field that actually really became at the heart of what we now call OpenAI, who built ChatGPT, or Anthropic, that built Claude. All the leading researchers of those places began AI safety, and I knew all of them. I collaborated with them, wrote papers with them, did research alongside them. So for a lot of us in that generation of folks, it really was this kind of natural process of moving from, wow, look at what we can do in a lab to look at what we can do to billions of people at once. I think the difference in my case was that first of all scared me and concerned me. And then secondly, it became a question itself that I wanted to address practically. So rather than just finding ways to deploy this technology to as many people as I could to see who we could addict through it, my question was, how can we create a new kind of interface and platform so that whatever is brought to market is something people feel more confident understanding, vetting, comparing, choosing between. And so that process for me is something I really began in earnest at Cornell. You mentioned I had a postdoc on the East Coast of Cornell. And it was while I was there that I began to productize, as we say, that vision into actual interfaces that people could use. And then after the postdoc is when I then incorporated this company, Hortus, which literally just treats that as our mission statement and business model.
Wow. Well, the way you describe Hortus Trellis consumer reports for AI tool is immediately intuitive. But behind that simple frame is a pretty complex problem. What was broken about how organizations were evaluating AI tools before something like Trellis existed?
Yeah, I mean, this is the great question of our time, really. Consumer Reports is like 90 years old. It was founded, I think, in the 1930s, at a time when
Mhm.
there was an awful lot of snake oil, actually from medicine specifically, and there needed to be, this was even before the FDA really was an institution, and so they were really one of the first established legitimate voices at helping people to distinguish which consumer goods were even worth considering, let alone which ones were best for you. If you were to ask a millennial, they might say like, "Oh, I like to use Wirecutter for kinds of goods," and so they might like use Wirecutter to say like, "Oh, what's the novelty vacuum cleaner that's best for me?" Stuff like that. But the secret sauce of those groups, and there's other, of course, consumer rating, platforms and services and softwares and consultants out there. The secret sauce for them is not just that they'll tell you what the best product is. They don't just tell you, "Oh, here's the best car." They do assess cars, but that's not really what they do. It's not real the value. The real value is, what does it mean to purchase a car today? What is a car today? What is a vacuum cleaner today? What is a
Right.
refrigerator? Like that stuff changes. Like what is it in 2026 versus 2025 or 2020 or 1950? That's really what they do, is educate the consumer about what does it even mean to purchase this type of thing and how will it change your life?
Mhm.
That's the white whale of AI, because
Right.
I'm sorry to put it this way. If you were to ask Sam Altman that, he doesn't know. If you were to ask Dario Amodai that, he doesn't know. If you were to ask the leading AI researchers, how will AI change how we live? They don't know. They say a lot of things, but they don't know because it's a mystery. No one knows. So our approach is to say, can we translate this kind of filtration that other brands have found in legacy goods and find a way to do that for AI so that that mystery can be properly fielded and be something that people can approach with intent, that they can actually deliberate about these options, that if they're ready to purchase, they know they're purchasing the right thing for them, and that we can track that adoption so that we can actually verify impartially if it goes well or not. Because then what that creates is not a doom loop like the one I was describing for Appalachia, but a virtuous loop. Because then we
Right.
take in all that feedback we get from adoption, from purchasing, from integration, and we use that to then improve the assessments we provide on those tools that are being brought to market. So it gets better and better over time. That's really the vision behind what we're building.
Right. Well, walk me through Trellis. You've matched over 2,000 AI tools against 750 use cases for a health system, CISO, or chief information officer trying to figure out which AI tools to trust for their specific environment. What does that process actually look like?
Yeah, for sure. So actually, both those numbers have over doubled. So we now list
Okay.
over 5,000 tools on over 2,000 custom use cases that we've created in house. Yeah, basically, in terms of the functionality, it might also be helpful to think about it as, imagine basically like Amazon. But imagine instead of Amazon searching for toasters or searching for books or searching for whatever, you're searching for AI tools. You might search for like, hey, we need this kind of platform, we need this kind of chatbot, we need this kind of agent. It needs to be able to do these things, this, that, or the other. You can customize it, mix and match it, and then whatever you search for, we not only show you the most relevant results, we rank those results based off of how appropriate they are for your needs. So you can filter by geography, you can filter by domain, you can filter by compliance, you can filter by past clients or past experience, you can filter by expertise, you can filter by whatever your needs are. And we also have our own in house assessments for how we do that. So we assess every listing on our marketplace according to the same criteria for security, privacy, and usability. So whether it's an agent or a chatbot or anything in between, we are able to rank them in the same way so that okay, rather than just my eyes rolling into the back of my head, what makes Claude different than ChatGPT? I hear things, but who really knows? We have a systematic way to say not only is this how they differ, but here is how each of those differs from the 50 other things that could also
Hmm.
effectively help you perform. And again, the goal is not just to say, okay, now you know this is the best one. It's to say, you now are in a level playing field with those companies because all those companies can see, oh, we're all being compared on those things. So we better do a better job on these dimensions if we really want your business. That's really the ecosystem that Trellis represents.
Makes sense. Well, healthcare is on your core use cases. And I want to go deep here because this is my world. You have Epic at 42% of acute care hospitals. You have AI tools flooding the market, ambient documentation, clinical decision support, revenue cycle, and you have security teams that have no framework for evaluating any of it. What are the specific failure modes you see most often in healthcare AI procurement?
Yeah, it's a great question. I mean, this is the real travesty of our time.
Mhm.
I often like to think about. I mean, it's funny. There's a show on right now called The Pit, which is like most of the way through season two, and about a fictional emergency room in near the University of Pittsburgh, I believe. So it's in Pittsburgh. Pittsburgh is basically like an Appalachian city or like foothills of Appalachia, and so a lot of the culture I was describing earlier and the relationships people do and don't have with healthcare are well conveyed in that show. And you see all the social inequalities and how those play with medical expertise. There's a major subplot of this season, which is that one of the attendings is trying to push an AI tool to basically automate and transcribe emergency health records for all their intakes. It's a great idea, but also I think a few hours into the shift, the IT system goes down. So basically, there's a cyber attack and what that means is that to protect the IT system, the hospital administrators decide to completely shut down the digital health records and everything about the transcriptions and really everything about the patients. So within a matter of minutes, they have to act like they're suddenly living in the year 1980, basically, is how it works. So I think that procurement is often messy. It's often Byzantine. It's itself something that I think needs to be reformed and streamlined and made more efficient to meet the challenges of AI. In fact, in many ways, Trellis is actually better thought of as a procurement platform, kind of like AI procurement as a service, rather than just some kind of marketplace in the ether. But I think one major example with AI is, you know, what does security and privacy look like when you're just kind of layering a chatbot, for example, on top of a legacy IT system that's vulnerable to systemic disruption, that's vulnerable to attacks, that's vulnerable to being stolen and theft in some way, that's vulnerable to people using it either inappropriately or just because they don't understand it. And so they might be miscategorizing certain things. Is the chatbot going to be something that worsens that dynamic or corrects for that dynamic? So that's another
Mhm.
example of like the difference between the former is a doom loop. The former can very easily spin out, and suddenly this tool makes your system 3 times worse rather than even just keeping it in place. The latter, hopefully, is the effort to make it so that we know we're integrating this in a way that when those disruptions might start to happen, because they will happen, in reality, those things happen, right? The question is, when they happen, is this tool going to help or hinder that process? And so that's how we grade all of our healthcare assessments, all of our healthcare apps, is what evidence is there that this system is going to be resilient to those kinds of disruptions or cybersecurity problems, rather than something that's going to be the first thing to fold or might even expose you even more than you were before you tried to integrate AI.
Wow. Well, what questions should every CISO be asking before they sign an AI vendor contract?
Well, I think that's the first question they should ask basically is what's going to happen if our IT system goes down? Like, does this thing just go belly up or not?
Mhm.
You'd be surprised. I mean, there's a corollary to what I just said, which is I think another question they really should be asking is, um, what is the personality of this system? This whole move to agentic AI, it's very hypey, and frankly, and I'm saying this as somebody who has a PhD from Berkeley in AI, so like, you could take that at my word. It's mostly a joke. Nobody knows what agents are. I could describe to you what the algorithms are that are responsible for the kinds of capabilities that get talked about, but I'm gonna say 99% of the people selling it couldn't tell you what an agent is. Like if you just said, just tell me what an agent is in your words. They can't do it. These are buzzwords, right? So I think what's really important for administrators is, not to pretend like they know more than the people selling the snake oil. That's not what I'm
Mhm.
saying. What I'm saying is describe to me what it's like when your agent interacts with people. And specifically
Mhm.
when it interacts with either patients or doctors or nurses or administrators, and distinguish those for me. Paint me that picture. Because what they're selling you is an agent that's going to coordinate your entire workflow. That's what you're being told, right? So if that's really true, it's going to need to have some distinctive behavior that is appropriate to each of those different channels. These are human ecosystems. This is human infrastructure. In order for these things to work well within it at scale, that needs to be respected. In fact, that itself needs to be scaled. If anything, you would want these systems to work in such a way that they help those stakeholders speak and communicate more clearly to each other. You already referenced this show, The Pit. A lot of the dysfunctions in that show come from these interpersonal squabbles that come from these different workflows of like residents hating, other folks in like their third year of their internship, something like that. Like those kinds of contexts are what lie behind those systemic failures. So look to the company to tell you, here is how we've built this agent to handle those types of institutional conflicts so that they can be mediated or diffused rather than boil over. Because I'm sorry, but the story of American healthcare system is one where often even very minor problems often are invited to boil over because we don't have those kinds of safety valves at a systemic level. That's really the promise of AI, is to introduce a systemic layer of control, observability, operational efficiency. That's the promise. And I believe in that promise. I am an optimist. That's the reason I work in this field. It is possible to do. Unfortunately, 99% of people selling it don't care and are not trying to build that.
Wow. Well, you published a paper called A Sustainable Path for AI Development and introduced a framework called Participatory Rights Based Accountability, Inclusive Sustainability, Evidence Grounded. That's a very specific vision for how AI development should work. What is missing in the current AI development that Praise is trying to address?
Yeah, praise is behind a lot of the vision of my company, of what Hortus does. And in a nutshell, I already referenced this doom loop, virtuous loop distinction. Praise is really just the analytic expression of what that entails. And in a nutshell, what that means is that those loops need to be governed from the bottom up and not only from the top down. So often what you happen, and again, this is a very Appalachian story, is that you have outsiders come in, they implement some technocratic solution that ends up, either by intent or not, to be extractive from the people, from the labor, from the resources of wherever it's deployed in a way that disproportionately benefits those stakeholders who are not only at the tippy top, but don't actually have any living relationship with the context they're extracting from. And that was true when it was about coal. That was true when it was about labor. And it's true now when it's about AI and data, right? So, what praise is expressing is not just an alternative vision, but what it's expressing is a different way to think about integration of AI capabilities so that it is guided by the voices, the feedback, the data of precisely those stakeholders who, in any other paradigm, would be the first to be excluded from how this process would go. So it's not only structurally much more equitable, but actually more accountable to the people that matter most. And because of that, performs better. If you integrate those voices first, if you reverse the flow of this feedback loop, the vector is the technical term for it. What that means is that not only will people feel like they're being respected, you will actually serve them better. They will, in fact, be better off over time because their problems then guide the next stage of implementation of enterprise AI rather than an increasing number of out of distribution data points that you kind of wonder, oh, we don't know why that happened or whatever. And so they get funneled off to some other part of your workflow that's not yet AI enabled, rather than being proactively put first and foremost in what would define successful adoption. So that's what praise would look like as applied to healthcare.
You work with government agencies, healthcare organizations, public institution. Give me example without naming names if needed of what it looks like when an organization gets AI procurement right. What did they do differently?
Yeah, following off of praise, we always start with the end user. The end user could be a citizen, they could be a patient, they could be, they could be the staff if they're the ones who are most often interacting with these AI capabilities. We always start with who is the person or constituency or demographic where that value has been promised, where you would want or expect to see it manifest. It sounds incredibly silly and even absurd to put it this way, but that's the opposite of the way AI tools are more often deployed. Usually, this is just based on some kind of handshake agreement between the enterprise leaders and whoever, whatever company lies behind the tool. And then deployment is in this kind of like waterfall of like, oh, we'll like get to that later. And like, we'll get back to you if there's a problem. And like, I think it's ridiculous, frankly. And so what we always do in our partnerships is we start with like, don't just tell us your use cases. Don't just tell us this, that, the other. Show us your stakeholders. Show us what they're already doing. And we will work with you to help define what success metrics would mean in the context of those specific uses that they're performing on right now. We always start with what things are. It's then our job to say, okay, what's the larger vision, let's say in like 5 years, 10 years, of what success might look like, which is often harder to describe quantitatively, but can still be described. You can still convey it. You can still describe the feel, the experience, what that might look like at scale. But we always try and relate that first and foremost to, in these very particular contexts, is somebody going to have a better day or a better outcome? Because instead of this legacy system, for example, that they were using to try to contest a parking ticket, how is it they could then use this automated interface to have it basically do that for them? What would success mean there? Are they saving time? Are they saving emotional energy? Is there a reduced number of prompts they have to put in? Or are there more because maybe they want more than just an automation? Maybe they actually want someone to help walk them through the process of understanding why they got that parking ticket or how else it could have been or what could they have done differently if there was a confusion over them like not filling the meter or something like that. Often, especially in government, but I think it's also true especially for healthcare, especially in an emergency room context, you're dealing with people who are already having one of the worst days of their lives. You're already speaking to a patient who has broken something or faced some kind of often unforeseen ailment. And this is also true for government. You're often dealing with folks, nobody likes, okay, like calling into the IT staff of like the city of, Tulsa, Oklahoma. No offense to Tulsa, but just you're not going to want to wake up
Yeah.
excited in the morning being like, I really want to talk about the audit I just am now undergoing. And I really am excited and chomping at the bit to make sure I have all the documentation I need. Nobody's like that. But these systems are often set up that way. So the challenge then is, can you actually make a person in that situation come away from the experience of interacting with an automated system, not just have it be better than it was before, but better than they could have imagined it would be going in? Because these people come into those meetings ready to fight, ready to be pissed, ready to be like, I don't want to deal with this any more than I have to. If we can have them leave an experience like that saying, wow, I could imagine doing that again. Like that was actually that was fine. That's the miracle of what like AI could do for these institutions and organizations, including hospitals and including other clinical settings. It's possible to do. But the problem is that the incentives don't yet exist at scale for that to be the default way these adoptions go. And that's the reason why Trellis is really set up to design those incentives. So I'm just relating that vision again.
Wow. Well, we're at an intersection inflecting point. AI is moving faster than regulation. Healthcare organizations are being pressured to adopt AI while simultaneously being held responsible if something goes wrong. From where you sit, what is the most important thing that needs to happen in the next 12 to 18 months to close that accountability gap?
Yeah, we've regressed to this kind of Wild West moment when it comes to AI regulation and AI policy. I mean, I lived this firsthand. I was living in DC for over a year, basically from like 2024 to 2025. So I saw the whole administrative transition. I was there for Doge. I was there for, I mean, all this stuff. And I was there in person at the hearing of the House Oversight Committee where they were debating preemption. So for your listeners, this preemption is this policy that they've now tried to enact where basically the federal government, for lack of a better word, is forbidding states from setting AI policies of their own, like
Mm,
actively preventing any kind of substantive regulation or legislation. Now, I'm not of the belief that a bigger government, a more powerful government, a more statutory government is good. That's not what I believe. I
mm,
already critiqued that waterfall idea of like how this stuff starts at the handshake level and then only like often forgets about the actual implementation. By default, just having more rules actually makes that worse. So I'm by no means saying we need more rules rather than less. What I am saying is, unless there are any standards for quality, unless there are any signposts for what distinguishes a good set of outcomes from a bad set of outcomes with respect to AI, that's not good for anybody. It obviously doesn't benefit the public. It also doesn't benefit vendors because they don't know how to compete. They don't know how to compare themselves against alternatives. And so they don't know how to improve. They don't have a realistic sense of what a better chatbot would mean if the
right.
Wild West just means that they don't have to do shit in order to keep marketing what they're doing and getting the lowest bidder to buy it up and just pass off the buck to somebody else. There's no ecosystem of accountability right now. So that's what's missing. It's not so much the need for more rules as the need for a sense that what is being said and promised is actually going to be delivered. That's that virtuous loop that we're trying to create.
Wow. Trellis has been in open beta with the Gov AI Coalition. What does the public launch look like, and what happens when this becomes available at scale? Who should be watching for it?
So we have a lot of traction right now in the B2G space and then also in the healthcare space. We are looking to increasingly grow into SMBs, so small to medium sized businesses. That can mean anything from your mom and pop stores, or even like, small healthcare clinics that are run by just a few folks, or maybe one GP, who need help basically saying, look, we don't have an enterprise level budget, but we also, and we're afraid to be first when it comes to AI adoption, but we're also terrified to be last. So like we're in this double bind. Like, what can we do? That's really what we're targeting. And so we will launch publicly and distribute this at scale when we know we've locked down the experience for those users so that Trellis could be used by conceivably hundreds of thousands or millions of those folks at once. That's really our vision. To be clear, our goal is to get there as soon as we can. And the reason is the faster we do that, the faster we reach scale, the more powerful that virtuous loop becomes. It's all about that for us.
Makes sense. Well, last question. For the healthcare IT leader listening right now, the CISO, the Epic Security Director, the CIO is on a board asking them about AI and the team asking them about what's safe. What is the one thing that you want them to walk away knowing from this conversation?
AI is not safe.
Mm.
That's the one thing I want them to know. AI is not safe. I am not someone who's going to push any AI tool in front of you because I get off on it or because I'm a huckster or because I'm going to try and scare you into thinking that you're better off taking that risk than not. Um, AI is not safe. There are specific AI applications and tools that might be worth investing in for your organization. Uh, I think that that's the minority of the tools that are out there right now. I think it's constantly changing and evolving. And I also think that it's best to take a proactive stance towards educating yourself about that so that when the time comes for you to adopt, you are fully confident in your organization's capacity to
Mhm.
absorb that power because it's really just raw power, frankly.
Right.
That's why it's not intrinsically safe. I mean,
Mhm.
there's an analogy here to say, you know, once the uranium gets past a certain critical threshold, it's not safe no matter what you do. We're not yet at that threshold yet with AI. In some ways, I think there are ways to adopt this responsibly so that it can be used to empower your organization to do, or that could be a clinic, could be a hospital, could be some other healthcare setting, to empower it to be what you always wanted it to be, to really let it serve the patients that you wanted scale to do right by your stakeholders in ways that were always in your mission statement, but always just out of reach. AI can actually bring those things in reach for you, but it can't bring those to you on its own. You need to be in control of that adoption and that integration, and you need to understand how it works so that when your organization starts to change through its deployment, you're ready for that. Not only ready for it, but excited for it. That's really the challenge of our time.
Mhm. Wow. Well, Tom, this is the kind of clarity the healthcare space desperately needs right now. If you are evaluating AI tools for your health system, or you want to understand what the responsible AI procurement actually looks like, Hortus Trellis is at trellis.hortus.ai. And if your organization is navigating AI adoption and you need specialized talent to do it right, Epic Security, AI, ML, healthcare, IT, you know where to find me at Zelcha, zehealthtech.com. I'm Zelcha Emmanuel. Know what you are buying before you deploy it. Thank you, Tom.
Thanks, Elsha. It's a pleasure.